What is the difference between Medicare and Medicaid? It can be confusing. They sound similar and may seem similar as they're both government run health insurance programs, but they're actually very different. The first big difference is eligibility. With Medicare, most people qualify at age 65 based on their work history or a family member's work history. With Medicaid, eligibility is based on your finances. You have to have limited income and limited assets too for certain programs to qualify. For example, with the Medicaid long term care program, you generally have to have less than $2,000 in assets to qualify. With Medicare, you could have millions of dollars in assets, and as long as you meet the work history requirements, you can qualify. Another big difference is how these programs pay for care. With Medicare, most doctors and providers seem to accept Medicare, but there are premiums and copays, meaning you may still pay a lot of the cost of healthcare with Medicare. With Medicaid, there are no premiums and almost no copays, and most or all of the cost of care is usually covered. However, many doctors and other providers don't accept Medicaid, so you have more choice in where you get care with Medicare. Finally, a big difference in the elder law context is long term care. Medicaid can pay for indefinite long term care in many different settings. That means Medicaid can pay for care in a nursing home for years and years, or in an assisted living facility, or with home health aides. By contrast, Medicare only pays for very limited long term care, such as paying for up to 100 days in a rehab facility. Medicare generally won't pay for nursing home or assisted living facility care. So if you or a loved one may need long-term care and you already have Medicare, it's still a good idea to learn about Medicaid. And if you're in New Jersey, we're happy to help you do that.